7:30 start. Go ahead and get started. Overnight oats, but I'm going for that. So I want to thank everyone who's coming out in person this morning to see Dr. Hart, who's just a very beloved biologist here. So just to give you some background on him, Dr. Hart is a professor of pediatrics at Virginia Tech and the former director of pediatric gastroenterology and nutrition at Carilion. He obtained his bachelor's degree in nutrition at the University of California at Davis and his master's degree in nutritional biochemistry at the University of Nebraska Medical Center in Omaha, where he subsequently obtained his Doctor of Medicine degree. He completed his pediatric internship and residency at UCLA in Los Angeles and his pediatric gastroenterology and nutrition fellowship at the University of Nebraska Medical Center. He is a past member of the AAP Executive Board for the GI section, past editor of the AAP Grand Rounds newsletter, and past chairman of the Clinical Practice Committee for the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. I can never remember what all that stands for. So in addition to introducing Dr. Hart, we also wanted to take the opportunity today. In 2022, Virginia Tech School of Medicine established the Dean's Academic Excellence Award to celebrate residents in their final year of training for exemplary achievement across several areas of academics. Specifically, the three criteria for this award are outstanding achievement in patient care, medical education, and scholarship, epitomizing system citizenship, and the values of Virginia Tech Carilion School of Medicine, which are collaboration and excellence, innovation and discovery, diversity, equity and inclusion, humanism and compassion, and a track record of service to the medical school through medical student teaching, mentoring, or service on medical school committees. We were very pleased this past year to give the first award to Dr. Manish Kumar, but in particular, in pediatrics, this award is being named to honor beloved physician, mentor, and educator, so Dr. Michael Hart.
Thank you. Oh my gosh, thank you so much. And Mike, come up here real quick. Stand up here, look pretty real quick. Nick's got to take your picture over there. All right, thank you.
Thank you.
So good to see. Thank you guys so much. It is so good to be here. I'll tell you, really exciting. Thank you for inviting me back. It's really wonderful to see everybody, and Dr. Chris has agreed to give me a little tour of the facility. I still don't know where the men's shirts is, but we're going to get it. I need the extra long. We'll get that.
Gotta get to the Kool-Aid first.
Yeah. But it is really terrific to see you guys because, and for those of you online, it's a blessing to be here. Thank you so much. This is really an exciting time in medicine, frankly. And one of the things I think that is exciting why I'm here to talk about is this whole business of infant formula, because I think infant nutrition is one of those things we talk about a lot, but we don't really have an appreciation, I think, at times how things have changed and evolved. And I wanted to kind of point that out for you guys a little bit. We're going to talk about innovations in infant formula. If I can get the clicker to work. Do I use the mouse?
Might need to be turned on the clicker. Sometimes there's a slider on the screen.
Okay, there it is. Okay, got it. Thank you very much. Here's my disclosure. And let's talk about the objectives, because this is really an exciting time, and I think we're going to talk about the impact of infant nutrition and growth and development. It's a passion of mine. We're talking about the first 1,000 days. And when I talk about 1,000 days, I'm not talking about from birth through 1,000. I'm talking about conception. And I think one of the things we as pediatricians understand and get better than any other group of physicians, I think, in medicine, is the whole concept of growth and nutrition and how it impacts infant development. And the reality is, I wish this room was jam full of obstetricians, because in truth, we as pediatricians kind of get, I hate to say the leftovers, when the baby's already basically born and developed in large part, and so much of what happens, we see the after effects of the consequences of maternal malnutrition, as well as other maternal catastrophes or infections or whatever, hypoxia, cerebral palsy, and so forth and so on. So one of the things that I'm very passionate about is how we can really impact maternal nutrition. We don't always have a shot, but we can't give up hope that we can work on this all the time. And we need to educate not only the parents. We very seldom get prenatal visits. We talk about this in theory, and wouldn't it be great to see moms when they're pregnant? Yeah. Most of the time, a lot of times, the first time the pediatrician hears from our families in the newborn nursery. And that's kind of closing the gate after the cow's out of the barn, so to speak. But we're going to talk about, they're also going to talk about the effects of prebiotics and human milk oligosaccharides. This is a big deal. All of our parents are aware of this. Nowadays you go to Walmart or Walgreens or whatever, you go over to the drug pharmacy area, there's prebiotics and there's probiotics and there's, all these other new things. Well, hopefully I'll demystify that a little bit. We're going to talk a little bit about exploring the role of DHA and ARA. This is docosahexaenoic acid and arachidonic acid. These are essential fatty acids, omega-3 and omega-6, that if you remember back to biochemistry, we can't synthesize these ourselves, but they're incredibly important structurally and functionally in terms of the infant's cognition and vision, as I'm going to show you. They're not all the same, so we really have an obligation to improve the nutrition of moms who breastfeed and the moms who don't breastfeed to improve the nutrition of the infant formulas they choose. And we're going to talk about something that may be relatively new conceptually for some of you. This is milk fat globule membrane, MFGM, which this is a hugely important factor. We're going to talk about the importance of it because this is a new entity in infant formula that has just now hit the market in the last 5 years. But I'm going to show you some of the data as to why this is important, because we really want to try to improve. I was looking at CDC.gov website yesterday because I was curious what the latest data shows in terms of breastfeeding. We all talk about breastfeeding as being the gold standard. Well, there's some realities we need to deal with. Number one, not all women breastfeed. In fact, CDC's data nationwide, now we all know that this varies, CDC's data nationwide shows that roughly 40% of women, 40% will be exclusively breastfeeding at 3 months of age, drops to 20% at 6 months of age. So what about the 60% and 80% that aren't? Do we really pay attention to those to help them? And of the 20% at 6 months who are, guess what? Not all breast milk is created equal. I'm going to show you some data this morning that tells us how important maternal nutrition is to make sure moms are getting adequate nutrition. Because of, as I'm going to show you with the fact of the milk fat globule membrane and the essential fatty acids, that in reality, these are incredibly important structurally and function-wise in terms of that infant's brain development. So we're going to talk about that whole moment. Keep that in the back of your mind the whole time, is maternal nutrition, infant nutrition, because that's why we're really here. We're going to talk about long-chain polyunsaturated fatty acids, the prebiotics. I'm going to give you some depth about that, understanding what that is. What are prebiotics? I always kind of summarize it to families. I said prebiotics are the fertilizer for your lawn. Probiotics are the grass seed for your lawn. You want to have a healthy lawn? It's a nice combination of grass seed and fertilizer. So that's really conceptually what HMOs and human milk oligosaccharides and probiotics do. If we look at long-chain polyunsaturated fatty acids, now remember back to medical school, these are basically essential fatty acids because we can't synthesize them. Remember, we can't synthesize omega-3, we can't synthesize omega-6. We can only synthesize omega-7 fatty acids. Well, guess what? These are incredibly important because structurally and functionally, if you look at all of us sitting here today, the cortex of our brain is 20% long-chain polyunsaturated fatty acids, DHA. 20% of the structural lipids, of the phospholipids, and yet we can't synthesize that. We must consume that from our diet. And guess what? 60% of the phospholipids of the retina of our eye are DHA. 60% for the babies and us. We can't synthesize it. We must consume it in our diet. So this really puts a burden of awareness on the fact that we must be looking at adequacy of macronutrients and micronutrients in our patients' diets. But we're going to talk about milk fat globule membrane, which, can I just get a show of hands? How many, by raising a hand, have heard of milk fat globule membrane? It's good. I'm going to educate you. When you walk out that door, you're going to be hearing about it, and guess what? This is a hugely important topic. When you look at advancements in infant formula, in 2001 was the first time in the United States that a product came to the marketplace with preformed DHA and ARA in the formula. 2001. In the last 5 years, milk fat globule membrane has finally been added to formula. It's always been in breast milk. It's always been in all mammalian milk, in colostrum. But you say, no, what is it and why is it important? I'm going to talk about it. There's data very impressive data. We know as pediatricians how important nutrition and stimulation are. They're a combination. We look at these factors, we can go back to World War II data, when the Germans had surrounded Leningrad, and we saw some data that came out of that was horrific in terms of the impact of malnutrition on children. We learned some things. We learned that about after age 3, that when you starve a child, as the Germans did, you stunt their growth. No surprise. It happens to us in nutrition, the undiagnosed celiac disease. We've been a starved child, stunt growth. You starve a baby up to age, from conception to age 2, you ruin their intellect, right? So that's why it's so important, because that brain is literally dynamic, changing the whole time. You can't rob it of nutrients, and you must also get stimulation. So this is basically to drive home the point. I don't know if you guys can see it up there. Does the mouse show? Does the mouse? Okay.
Pointer's a nice thought.
Can you see? Can you guys see that? Okay. So basically, it's the concept of the nurture and nutrition is critically important in terms of that development, that combination. All of these nutrients, macronutrients, micronutrients, I won't bore you with all of them, but we all know how critically important these are. You know, we talk about folic acid. You know, that's really changed over the last 30 years in medicine. Now it's automatic. Oh yeah, folic acid, neural tube defects, yada yada. Well, guess what? I know some of you are subscribed to the blog I send out, or the email I send out. Vitamin D, in terms of its relative importance prenatally for that infant, in terms of, you know, allergy manifestations, but not just bone, but also anti-inflammatory things. We know iodine, of course, iron. A lot of these other factors are hugely important. We know that the long-chain polyunsaturated fatty acids are critically important for structure and function in terms of the composition of the cell membrane phospholipids. We know the immune functions. We modulate these all the time in medicine. We take an anti-inflammatory. We take an ibuprofen. We take drugs that interfere with these pro-inflammatory and anti-inflammatory cascades. The omega-3s are generally considered anti-inflammatory, so we see fish oils, fish oil enemas, fish oil supplementation, in whether it's inflammatory bowel disease or whether it's atopic manifestations or asthma. We recognize that anti-inflammatory, even the cardiac role that they have in adults. Some of the data that the American College of Cardiology, in terms of the EPA, the omega-3 fatty acids play a role in terms of, you know, cardioprotective effects as you get older. Some of the omega-3 data even shows some effects on dementia and macular degeneration. We're not here to talk about that. We're here to talk about the structural function of the babies, because it's really critically important. The nourishing diet, the nurturing environment to support this brain development is critically important. This is why I love pediatrics. We have impact. Nothing against geriatricians. I'm not a geriatrician. But what we do impacts kids for 80 plus years. And that's what is so exciting. That's what drew me to what we are doing here, is the fact that we change lives for decades. It's not a matter of putting out the fire. It's a matter of building the building. So it really is important. So we know all the nutrition environment, microbiota, we'll talk about that a little bit, and nutrition is critically important in that first 1,000 days. The fatty acid delivery story is an important one and hasn't gone away. All of the companies certainly recognize this, but more important than just the companies is when you have a mom who's nursing, we now have an obligation to deal with maternal nutrition. Just don't make a checkbox. Oh, good. Exclusive breastfeeding, good. Let's move on. No. The game is on, because you've got to have education to that mom. If you look at the fecal body fat accretion during the gestational period, look at this. And you see this huge accretion from gestational through the DHA, the phospholipids. 90% of that fat deposition occurs in the last 10 weeks of pregnancy. So what happens if you have a 30-weeker? They get shortchanged. The formulas are trying to compensate for some of that. If you look at the composition of the preterm formulas, you look at the composition of the follow-up formulas, they're quite different. These are not the same. We don't give fresh cow's milk to newborns for a reason. The macronutrients and micronutrients are quite different. And so it's very important. We see the most important determinant is the fatty acid profile. The maternal diet is the diet. DHA is stored, interestingly, docosahexaenoic acid, in adipose tissue as a reserve. I mean, I told you the structural, 60% of the retina, 20% of the cortex. But the storage actually occurs in the adipose tissue, and it's felt to play a role during periods of deficit, so that the baby has some storage DHA to draw on. I know it's risky to show a biochemical slide this early. I hope we'll create knowledge, but only one point to drive home is that there's this conception. Oh, it's omega-3. Remember linoleic acid? Linoleic acid, 18 carbons, omega-6. Linoleic acid, 18 carbons, omega-3. Precursors. Well, guess what? Studies have shown us that I can't give a pregnant or lactating woman enough precursor to have her achieve optimal levels of preformed DHA in her breast milk for her baby. Because we, as humans, lack this delta-6 desaturase that converts and makes that DHA possible. So there's a rate-limiting step in the biochemical synthesis of these critical essential fatty acids. So we must consume it for the diet. But if you look at pregnant women and you look at lactating women worldwide, you see this is hugely variable. You see that in the light blue, these are basically the levels of maternal DHA in their breast milk. Dark blue is maternal ARA in the breast milk. And you see that obviously very high fish-consuming cultures have very high levels of DHA. And very heavily agricultural organizations have very high, tend to be more of an omega-6, lower DHA. So if you see here, the worldwide median is 0.32. Look all the way over right here. This is really worrisome to me because this is a national trend of donor breast milk being very suboptimal in omega-3 fatty acid levels. This is significant. And I think we don't quite understand why, but I think a lot of it is if you talk to women who are donating their breast milk, once they're their child's old and they're continuing to nurse and pump and feed, their fortitude was staying with their prenatal vitamins, which are not free. They have to go out and buy that at Walgreens or or CVS. They say, my baby's already a year, I'm moving on. The DHA intake for the moms, and there are a lot of the prenatal vitamins now do have preformed DHA in them, thank God, but it's not a requirement, even though it's morally required, in my opinion. It's not a requirement. And when women go out, and buy stuff themselves, a good case in point is infant formula. I think a lot of you would be surprised to realize that 25% of all infant formula in the United States is sold off of a Walmart shelf. Think about that. Who's shopping at Walmart? Value-conscious consumers who are looking at price, not composition, looking at price. And there's a misconception out there that all these things are equal. They're not. And so it really puts a burden on us as healthcare providers to make it educated of our consumers. So I just want to remind you that the key nutrients that moms require during pregnancy, you can see those there. These are all critically important. We know the supplementation with omega-3 is necessary. We see it enhances newborn brain size, gestational length, which is a good surrogate marker for growth. A lot of other benefits we'll talk about, including the composition of human milk. Human milk is composed by the diet. And this is really challenging to us because maternal diet plays a huge role. So if you look at the data from, sorry, I popped it too quick. I'm going to show you data coming up here about the importance of DHA and ARA levels based upon mom's diet because it plays a huge role in her breast milk levels. And we can't any longer say breast milk is adequate. Breast milk may not be adequate. I'm going to show you some pictures. You want optimal breast milk. Not just breast milk, you want optimal breast milk. This prebiotic business, what is that? Well, breast milk has 200 plus prebiotics in it, human milk oligosaccharides. And so all formula companies have kind of gotten onto this. You guys may read about this stuff on adding these prebiotics, human milk oligosaccharides to their formula. This is the fertilizer that optimizes the growth of good bacteria. Why you have more bifidobacterium than you do Clostridium or Pseudomonas. They support beneficial bacteria. They actually inhibit to prevent bindings of the pathogens. We use prebiotics and probiotics a lot in medicine, but they're not ubiquitous and they're not free. So when parents ask, you have to use data, you have to use science. There are situations where you can use probiotics in an optimal clinical sense, but just going out and spending money willy-nilly on probiotics doesn't mean you're necessarily healthier. okay? Although you watch cable TV at night, it's all about gut health and this product and that product and dysbiosis. This data from prebiotics looking at the number of bifidobacterium species detected. This is blue is control and the yellow is a combination prebiotic polydextrose galactosaccharide. So literally what you see is that after 30 days and 60 days, you see a morphing of the intestinal microbiota in a more bifidogenic environment. That's good. Bifidogenic environment is good. It means more good guys growing Lactobacillus bifidobacterium than bad guys, Clostridium difficile or Pseudomonas. You see that part of the reason why this works is that oligosaccharides are metabolized by bacteria, not by us. They're fertilizer for the bacteria. We can't absorb them. We can't digest them. We handle some of the byproducts of them, short-chain fatty acids and such. But you see that basically they can be different, and this happens in breast milk and it happens in formula now, where the prebiotics are metabolized by bacteria differently depending upon whether you're in the colon or you're in the proximal colon or distal colon. One new one is this 2-fucosylactose. This is actually a human milk oligosaccharide, but this is now present in some infant formulas. It basically supports growth, and it helps in a lot of ways. These prebiotics have now been shown not only to beneficially help this bacterial composition, but it translates into immune benefits, less atopic disease, and less dysbiosis. So we think even fewer autoimmune kinds of things. It's very exciting data. I think it's a real novel kind of moving target, so to speak. So prebiotics support infant health by promoting the growth of beneficial bacteria. We see that these galactosaccharide polydextrose shown to have a bifidogenic effect, and the human milk 2-fucosylactose is well tolerated. So if you look at, back to the essential fatty acid data, the brain growth on the left-hand side, that baby is growing like a weed. In fact, if you look at this dotted line here, this is term delivery. In the last trimester of pregnancy, the baby's brain is tripling, almost tripling in size. Think about that in terms of turnover tissue-wise. It's as constant, it's like building a skyscraper in a day. Tripling in size in the last trimester of pregnancy. In the first year of life, more than doubling in size. 175%, and you see then at 18%, and then it flattens out so that the rest of our lives it'll increase another 21%. But we're stuffing knowledge in, provided we've laid the appropriate groundwork. If you see the DHA accumulation in the brain, you can see that from birth up through 15 months of age, it's a linear increase as you'd expect because these are basically growing. And there, as I said, the cortex of the brain and the retina of the eyes are, among other tissues, are critically important in terms of the deposition. But this is a very provocative slide because this gets to why breast milk is not all the same. Once you have a patient today in clinic who is saying they're breastfeeding, say, okay, are you still taking your prenatal vitamin? Does your prenatal vitamin, what brand do you use? Does it have DHA? In fact, I would ask you, challenge you to ask moms without provoking, what do you think about fish in your diet? If you go back to the 80s and 90s, fish was brain food. I remember countless magazines, pictures of fish and fish as brain food. We recognize this connection. You know, I'm dating myself, but my fellowship in the early 80s, mid 80s, I remember I went to a conference in Arizona about primate data from Chileanist primates, and there was incredible fish oil, omega-3 stuff back then that was looking at emotional development, cognitive bonding of parents, all kinds of really exciting data. Well, this came into human data shortly thereafter. Sheila Ellis did some great work on this. She published this data. And at first what you're looking at here, she measured no supplements. She wasn't giving any pregnant woman anything. She just simply did a study, an observational study, where she looked at all breast milk DHA levels, all babies' bloodstream DHA levels, and then looked at visual acuity, which we all know you can do visual acuity, brainstem visual potentials in babies. She then looked at the outcome on the right-hand side and then went back and said, okay, how did that correlate with mother's DHA intake and mother's DHA blood levels, mother's DHA breast milk levels, and the baby's DHA levels themselves? Turns out it's a linear relationship, and she divided them into thirds, where you basically had low, middle, and high DHA of the pregnant women. In the babies, they correlated exactly, as you'd expect, You'd expect that. All monogastric animals would do that, whether it's pigs or, whatever. Ruminant animals, different story, but monogastric, we are what we eat. So if we eat very high omega-3s, we're going to have high omega-3s in our tissue. And look over here on the right, all breastfed. The babies whose moms had the lowest intake, and they had the lowest intake, had poorer visual acuity than the babies whose moms were in the higher, at both 2 months and 12 months of age. So that's an incredible outcome, all breastfed. I sure as hell want my grandkids in this high area, not the low area. And they actually, back then when my kids were small, they actually had DHA supplements. Most of the DHA supplements now, I mean, you can get fish oil supplements and whatnot, most of them now have been incorporated into prenatal vitamins. But you have to look at the label because they're not all the same. And the state of Virginia has a policy. When the obstetrician sends a woman to the pharmacy and says, give her a prenatal, he can order, or she can order the DHA containing supplement, but the pharmacist can switch that out. If the pharmacist doesn't have it on the shelf, they can switch it out to, the generic version that doesn't have DHA in there. So this is something left up to us, as to why we really need to pay attention to this. If you look at the outcome, this is DHA looking at various outcomes of MDI score, kind of infant IQ type of test, formula with supplemental DHA, formula without DHA, and this was up until, like I said, 2001. No formula in the United States had preformed DHA in it. They all had precursors, they didn't have preformed DHA. So we see a 7-point IQ difference outcome data, basically looking at that, and also some great John Colombo at Kansas did some unbelievable work on attention deficit disorder, kind of cognitive studies in kids. You'll see a lot of these studies. You basically, the kids who had the higher DHA containing in their formula and breast milk had better attention span. So that really translated in terms of functional outcomes, paying attention. Certainly attention span is going to be very important. Vision, we know the importance of the retina, the development of the DHA. This is sort of a comparative study looking at what it would be equivalent with the formula with DHA supplementation optimal versus no DHA, viewed to be one line on the eye chart difference. Big important difference. This was looking at the Peabody Picture Vocabulary Test, basically looking at a cognitive performance, executive function performance, looking at kids who had higher DHA, 16% higher performance on their Peabody Picture Vocabulary Test than patients who did not, babies who did not have DHA. And it gets back, I mentioned to you, allergic manifestations, autoimmunity, dysbiosis, all this kind of stuff, it is interrelated. So we're starting to recognize this. We see on the cardiac side of things, the pro-inflammatory effect of omega-6 versus omega-3. So in terms of, even the adult cardiology world, looking at some of the supplements that are on the market, we recognize that a lot of those effects are mediated differently. The omega-3s we talk about in adult health are typically mediated with anti-inflammatory benefits, IBD or whatever. The omega-3 benefits in children tend to be mediated through structural, functional outcome of phospholipids in our various membranes. So they're important. Vitamin D, same way. We tend to think, well, vitamin D was just bone. No, we recognize now in 2023 that vitamin D is one of the most important inflammatory modulators in our system. We recognize the importance of that, and we see this with the DHA, but also see this with vitamin D. The age of first diagnosis of an allergic manifestation in the DHA containing is much longer than it is in the non-DHA containing, so that it really translates into allergic benefit, less asthma as you grow, and so forth. So recognize it really is an important longitudinal thing. Because once we kind of set the stage, we recognize that these kids that's why we see all this ridiculous, autoimmunity that's getting worse, and type 1 diabetes and more IBD and all this kind of stuff. Clearly something is screwed up in our world, in our environment. And I think that most people start to understand, wait a second, it's dysbiosis, it's in a relationship of the gut with the bad microbacteria, it's some of these macronutrients effects in terms of the inflammatory mediators. It clearly all is tied together. So DHA and ARA are very important in early life. The brain's rapidly growing. We know it's associated with improved brain and eye development, higher cognition, enhanced verbal ability, executive function. It's also associated with lower incidence of infection and atopic manifestations. So let's change gears, because this is probably the single biggest development change in infant formula in the last 50 years. DHA and ARA I just mentioned to you, critically important. But if there's one thing that's finally brought some clarity to why breast milk has historically been better, it's been the milk fat globule membrane. So what is a milk fat globule membrane? Well, all mammals have milk fat globule membrane in their breast milk. All mammals do. And what it is basically you see the center triglyceride core, and then because oil and water don't mix, the body has to envelop that with a bipolar membrane. And in that membrane are gangliosides, glycolipids, phospholipids, of course, sphingolipids, which I'll show you how important they are, and proteins. So we recognize why breast milk is beneficial in so many ways, and a lot of data, longitudinal data. The Europeans are great for this because they had socialized medicine for forever. You can look at some incredible data on breast milk outcomes at age 19 and 27, showing improvements longitudinally in terms of IQ and income and things like that. It really does translate into best. But now that we start to understand why, we recognize not all breast milk is the same. So now we have a challenge, and we'll leave you, when this is done, with kind of an awareness of how important this milk fat globule membrane is. So this is a scanning electron micrograph of a rabbit mammary gland. You see it's extruding, and as you might expect, when oil extrudes out of a typical cell, it's got to be enveloped with something that's bipolar. It just doesn't mix. You don't have oil droplets floating in your bloodstream. So basically, you see this bilayer plasma, the packaging, the milk fat globule membrane is this complex trilayer where it's polar on one side and non-polar on the other. So the non-polar is inside, polar is on the outside, kind of water. And if you look at myelinization, this is really critically important. We know as pediatricians some of the disorders that we see, horrific disorders we see in terms of myelinization disorders. In terms of the, what do you call them, all kinds of other sorts of things that these kids die horrific deaths, when they don't have proper myelinization. So we know myelinization really increases the speed of neurologic, neuron transmission, if you will. We know the key components very well, long-chain polyunsaturated fatty acids, as well as choline, phospholipids, sphingomyelin. So we know that these are nutrient deficiencies that are so critically important in terms of the structure and function development of myelin. And this was kind of a really provocative. You look at synaptogenesis. It occurs at a higher rate during the first 1,000 days than any other time of life. This is sort of a synapsis if you see, the prototype, if you will, kind of cartoonish, to see how rapidly the synapses are occurring. And you see that nerves don't work well when they're demyelinated. The action potentials don't propagate fast. You throw myelin around there, all of a sudden they're propagating big time, and that's what God intended. They're incredibly effective. So if you look on the right-hand side here, this is the synaptogenesis. This stunned me. In fact, I had to go back and look at the original data because it's almost unbelievable. It's the formation of maintenance between synapses and neurons. 1 million new synapses are formed every second in early childhood. Think about that. 250,000 axons are created every minute in that developing baby. 1 million synapses per second. That's assuming that we have laid out all the precursors so that we can do that. What if a baby is shortchanged? Well, not surprising that the neurologic impact of that is massive. So if you look at milk fat globule membrane, where all these structural things are in the formula. Now, the reality is infant formulas, right now, 2023, not all infant formulas have milk fat globule membrane. Very few do, in fact. Most do not. How infant formulas are made historically is the biochemists would kind of separate, the protein fraction, the liquid fraction, the macronutrients, that take off the lipid, it kind of goes into butter or ice cream or whatever. The biochemists would then add back into the formula the essential fatty acids, so much palmitic, so much stearic, so much linoleic, and they try to give a gas chromatograph similarity so that the formula would look like the breast milk. Well, what was missing were these complex lipids, the sphingomyelin, the gangliosides, that basically are in breast milk. in all mammalian colostrum and milk, but not in infant formulas. So we've always seen a disconnect in terms of performance, whether it's IQ or whatever, between a healthy breastfed control and formula fed. But as I said to you right now, at 6 months of age, you guys, 80% of your kids are on formula. So what are we going to do for your child or your grandchild? So this is helpful to kind of put all that in perspective, how important this is. So this is getting lipids from the milk fat globule membrane components and their impact on brain development. This study, and these are all impressive. You look at the statistical data, it just blows you away. This is a double-blind, randomized controlled trial. All these trials I'm going to show you, double-blind, placebo-controlled, randomized trials. Adding MFGM components versus not. So the standard formula does not have MFGM. The blue formula that does have MFGM at higher. Now, all formula that has whole milk has some MFGM in it, by definition. But what I'm talking about is MFGM added to 5 grams per liter, which is 100 times more than whole milk would be, more like what breast milk would be. So breastfed, there's a yellow breastfed control too. And then at this point, they were looking at Griffith's mental developmental scale, which is sort of like Bailey. It's sort of an infant functional IQ type of test. You see in a performance score, a hand-eye coordination, and total score, you see clearly the MFGM group performed much better than the non-MFGM group when you looked at this in the Griffiths. Another study looking at Bailey 3 developmental testing, which we're all pretty familiar with in pediatrics. Once again, this double-blind, placebo-controlled, non-MFGM, MFGM, and breastfed. And you see basically, this was a first study, basically that showed that the MFGM formula performed as well as the human breast milk, both of which did better than the non-MFGM, 4 IQ points difference, equivalent. So it really was kind of a game changer to say, wow, this is a really important functional outcome. This is independent of the DHA, but DHA is part of the groundwork that's critically important. But this really takes it to a whole nother level. So if you look at this study, looking at the MFGM enriched formula on myelinization, this was a fascinating study, basically looking at standard formula, MFGM, and breastfed. And the outcome was measuring MRI. And I'll show you some data, just amazing. If you haven't seen these MRIs that are done, there's a fellow Brown that really is doing some, Sean Biondi, that's doing some amazing stuff looking at where you can actually look at composition through MRI of infants, of looking at various parts of the brain to see how are these babies myelinating. Are they myelinating well? Are they not? You can actually do a quantification, if you will, looking at cognitive scores, Bailey 3, and then this Achenbach system of social emotional development. It's called Achenbach system of empiric, and then the sleep study, the brief infant sleep questionnaire. These are all endpoints that basically were looked at. And what you see here, this is basically the investigational group is in pink. Breastfed is sort of in their bluish thing here and control down here. And this is looking at MRIs, structural MRI. I won't show you the picture, but structural MRIs of different parts of the baby's brain based upon whether there's MFGM in the formula or not, or whether they're breastfed. You can see that basically from the whole brain, the parietal, corpus callosum, the body, the sputum, all of them improved relevant to the non-MFGM, did as well as breastfeeding. So another study looking at, in this case, Bailey 3 cognitive score, standard formula, MFGM, and breastfed, looking at the Bailey 3 outcome. And you see here that basically this is once again, you see the study formula, the breastfed group did as well as each other, both of which did better than the control group. Another different study done more recently looking at prospective MFGM, in this case with standard formula, once again, MFGM formula breastfeeding, looking at cognitives at 12 months of age, and basically seeing the significant improvement in terms of cognitive outcomes. This is looking at a social emotional outcome, general adaptive, and short-term memory. Basically you see the serum gangliosides were all higher in the MFGM, as you'd expect, because they reflect the dietary intake. Short-term memory improved, and you see the social emotional control scores, and also aggressive scores, as I'll show you. It's very impressive data. This is a similar study looking at same format. The outcome here is to measure Griffith 2 at 24 weeks change. And you see here basically the performance score, hand-eye, and total score being better. So if you look at, this is a study looking at single myelin enriched formula, And you see basically that this is very low birth weight. And as I mentioned to you, the kids that we really worry about the most are the ones that get shortchanged the last 10 weeks. Because they lose that placental transfer, the preferential transfer of omega-3 fatty acids and some of these important structural functional lipids in from mother to child. They're shortchanged. So in this particular study, the highest risk kids, and they looked at the Bailey's, the Fagan infant intelligence, the VIPs, attention memory test, and look at the same outcome types of things. And not surprisingly, you see basically the Bailey sustained attention and the Fagan test of infant intelligence all improved when they have this sphingomount to the preterm infants as well, the highest risk kids. So if you look at this is another similar study, multi-center, looking at the standard formula, MFGM formula, cognitive Bailey's at 12 months of age, and not surprisingly, you see here the control in pink, versus the MFGM supplemented, for language, motor, cognitive, words produced, sentence complexity. So we're starting to see some really impressive outcome data. Now all that's neurocognitive, but we're starting to recognize, we said, but breastfed women their babies tend to be healthier, fewer infections and so forth. There's some immune benefits from their HMOs and some of those kinds of things. This is looking at behavior and immune outcomes. There's an infectious one to come, but basically look at this behavioral assessment. Now, these are older kids. You're basically giving them the 2.5 to 6-year-old kids. These are preschool kids, kind of after the brain's been functionally sort of structurally formed, and they're looking at standard chocolate milk versus chocolate milk with MFGM. And the outcome was looking at behavioral assessment, and also looking at number of days with fever, diarrhea, coughing, or constipation. So if you look at this behavioral outcomes, this is really provocative, because the children who had MFGM, these are by parental report, double-blind, placebo-controlled, the docs nor the parents knew which their children were on. We still see that the kids had far less withdrawn behaviors, far less external behaviors in terms of aggression, and far better total problem scores. Really breathtaking, and you look at the statistical power. These are impressive data to say, holy cow, we may have found the holy grail, so to speak, of why these kids are so different, provided they're getting an optimal breastfeed. You can't read this in the back, of course, but basically this is long-term. We're starting to translate some of this into long-term data. This is age 6. I'll read this part down here. It says the added, I should mention bovine, milk fat globulin. Why it's bovine is human milk obviously has milk fat globulin membrane, but all mammals have this amazing conservation of MFGM structure and function. So mammals have this remarkable ability to, where it comes to MFGM, to benefit from cross mammalian. It doesn't work that way for proteins. Soy milk and goat's milk and mare's milk and cow's milk, human milk, they're all structurally, both secondary and tertiary structures are different in those proteins, but not so with MFGM. So in this study, giving bovine MFGM and lactoferrin infant formula had persistent effects supporting neurodevelopment at preschool. Feeding infants formula with added MFGM and lactoferrin through 12 months of age, neurodevelopmental outcomes were improved between 5.5 and 6 years of age relative to control. And here's a study at 14 years of age, looking at executive functions at 14 years in these kids. We've shown this with breastfeeding decades ago in 19 and 28 in the European studies in cohort followed, that there was improvements in cognition when normalized for income and smoking and single parenting and all those other factors. We see here in this case where the infants who got the MFGM had significant advantages on these strategic memory task executive functions at 14 years of age, even when the covariates were appropriately controlled. So we start to see that this MFGM is a magic stuff that basically it should be in there in all formulas. It's not yet, but hopefully it will. We see that outcomes are improved cognitive scores, IQ, attention scores, narrowing the gap between breastfeeding, formula-fed kids, and cognitive development, improved brain structure, myelization we can measure through MRIs of babies, improved short-term memory, visual potentials, visual recognition, and long-term developmental impacts. We also see improvements in these behavioral things, which I think require a lot more attention, because these are really important outcomes for parents, in terms of attention deficit, aggression, behavior, social outcomes, and so forth. So if you look at these back to this immune, finishing the other piece of the other end of the teeter-totter, looking at the immune function, You see, in this case, the endpoints being measured were incidence of infectious diseases or other indications of disease in these various cohorts, control, MFGM, and breastfed. So what you see in this provocative study is you see the standard formula. Here's incidence of otitis media as diagnosed by a pediatrician who didn't know what the babies were on. You see here in this case, they had 9 cases of otitis media, only 1 in the study group, and none in the breastfed group. So that's an almost 90% reduction in the incidence of otitis media. So why? Why does that happen? Why are breastfeeding women have fewer infections? Well, we know there's a lot of factors. Passive immunization from colostrum, that certainly helps. We know some of the other factors moms give, HMO and so forth, dysbiosis. But it probably, in this case, the whole dysbiosis thing is probably where we end up at, because when we talk, we know that MFGM modulates and modifies the good bacteria and the bad bacteria. That MFGM has, in that surface of the membrane, has antibiotic-like effect. It has lactoferrin, lactoferrin, has other proteins that inhibit the growth of bad bacteria. So in this study here, you see the MFGM compounds. What you see on the left-hand side is EF stands for experimental formula, SF for standard formula. These are the bacteria going down this way from the throat culture from these kids that were on the study. And magnified down here is expanded up here is Moraxella catarrhalis. And you see that it's 4 times more common in the control group than the MFGM group and the breastfed group. So just the presence of a pathogen in the hypopharynx is probably why the researchers felt that we saw such a drastic difference in the infection rate of otitis media. If you look at fever outcome, these are older kids, toddlers and preschool kids. They were fed a formula, milk, chocolate milk that had MFGM or not, and just looked at fevers and outcomes, and the use of antipyretics and antibiotics. So you see the standard formula and the MFGM formula, significant difference in terms of less fever, less antibiotics, less antipyretics. You see in terms of other complementary foods, looking at outcome of diarrhea status in this study. And what we saw is the number of diarrheal episodes dramatically improved with the MFGM supplement group. Diarrhea prevalence also statistically improved as well. So basically, we in the pediatric world know how important pregnancy is. It's a critical time during that. Maternal nutrition is a key factor. So we really have to counsel and work hard to improve, make sure they're getting the adequate supplements. We see the devastating consequence when they don't. But this is really critically important. We know that optimal nutrition during the child's first 1,000 days is essential for having critical periods of growth and development and fueling infant growth and toddler growth. When added to formula, the prebiotics are safe, effective, contribute to normal biosis, if you will, normal microbiome, normal microbiota. And you see other things. We see the after effects all the time in the nursery. You know, when a kid's born at 26 weeks, the premature rupture of membranes, what do we have to do? A septic workup. What happens? The kid gets infant. We see the consequences. We're very good at killing bacteria. Not so good at planting lawns. But we have to conceptually work on that. So many of the nurseries, our nursery used to, I don't know if they still do, I think Floor Baby was what the brand was there. Are they still using Floor Baby in the nursery up here? Anybody know?
We've cut down a lot.
Cut down. So basically there are, most nurseries, about half around the country, are still using in selected circumstances, not all, selected circumstances, probiotic, prebiotic containing products that basically help to reduce, in some cases, the effect of necrotizing enterocolitis and some of the other longitudinal effects that we recognize are necessary or occur with dysbiosis. We know that DHA and ARA are important in early life, improve brain and eye development, higher cognitive scores. And last but not least, this MFGM, which is a new thing for most of you. It's a big deal. This is starting to be one of the reasons we understand why breast milk is so unique and beautiful. But we're faced with the fact that at 6 months of age, 80% of the moms you see are not breastfeeding. There are some that do a little bit of social breastfeeding supplementation, which is still good, better than nothing. But I'm talking about exclusively breastfeeding. So we have an obligation to educate and to use the best thing we can possibly use. So let's just close it out with before questions. I just had some board type of questions. 2-week-old infant, premature birth weight of 1,200 grams, uncomplicated history other than transient hyperbilirubinemia, received fortified breast milk until discharge, 36 weeks. Mom wishes to discontinue, pretty common scenario. Mom asks for baby can be switched to a term cow's milk formula instead of her breast milk. If done, what condition would be the infant be highest risk for developing? The osteopenia prematurely. The formulas, if you look at the transition formulas and you look at the preterm formulas, they are nowhere close. Because we recognize that in that last trimester of pregnancy, that placenta is magical, magical. It has a 1-to-1 ratio of a lot of nutrients like sodium, but where it comes to things like essential fatty acid and vitamin D and calcium, there's an active accrual or transmission from the mom to the baby, even to where sometimes moms will become deficient in her own omega-3 levels to try to preserve that for her baby. So the preterm formulas have to be different compositionally. You don't put a 6-month-old normal healthy kid you see in the clinic on preterm formulas. Well, you wouldn't do the reverse either. You wouldn't put a full-term or preterm baby who's not full-term. So now we have the preterm formulas and we have the so-called transition formulas that are basically the 22 cal. If you look at the composition of them, they're different though, because babies need that added macronutrients. And osteopenia is a big deal because calcium intake is critically important. Second question, a 2-week-old seen for persistent vomiting. Standard cow's milk formula is 4 ounces every 2 hours and vomits most of the feeding, despite burping. Emesis, non-bloody, non-projectile, 3 to 4 stools a day, negative hemoglobin. Weight gain surpasses birth weight. Exam is unremarkable. The most likely cause of the symptoms? See? Overfeeding. I mean, I always joke because what happens, we see this happens to the kids all the time in the clinic. I always tell the moms, 8 3-ounce bottles are a hell of a lot better than 3 8-ounce bottles where it comes to reflux and vomiting. Because what happens is, moms start out with, they want them all to sleep through the night, don't they? So they stuff all the rice in the formula bottle, and they give them these infant feeders, or they give them this 8 ounces, and guess what? They puke after. So they quickly give them another bottle. So what they end up having is, they end up having 8 8-ounce bottles, of which 80% is on the floor or on themselves. So if we just say, hold the phone, let your kid do 3 ounces and wait, walk, wait, whatever. Because overfeeding is a big problem, weight will happen. I mean, every parent wants their 2-week-old to sleep through the night. Who doesn't? But tell me, how many of them are going to? And, I don't want to give any kind of pharmacology support or whatever. Last question. Typical number of neuronal synapses created in the last third of the baby's first year of life. Normal childhood development, this is from the Harvard Child Development Group that published this data. It blows my mind. 250,000 per minute. That's actually the number of axons created. 250,000 per second, 1 million per minute, 1 million per second. Does this blow your mind? This blew my mind. I said, that can't be right. Holy crap. Yeah. So, anyway, with that, I've got time for questions and answers if anybody has any. I'm here to thank you guys for your attention. I really appreciate it very much. And I don't know how, I think most of you guys are getting my email blast. Okay, if anybody's not, you can send me a note and say, sign me up in your blog to that email address right there. But as you can tell, I love this stuff because we make differences. But there's a misconception out there that they're all the same. All products are the same, and not only is it not the same for formulas, it's not the same for breast milk. So I want you to think about that when you're talking to the mom, the importance of continuing. Look at the donor milk levels. That's disgusting. If you know a donor milk situation, you need to make sure that mom is taking her prenatal vitamins. She's still supplementing with adequate amounts of DHA, because if that donor milk is coming to my grandchild, I want the high-test donor milk. I don't want the cheapo donor milk. You know what I'm saying? Other questions you guys have? Comments?
Just got more of a comment, Mike. First, thank you for not showing the synaptogenesis for those of us over 50. I suspect it dropped into the negative range, which will then negate all of my other comments.
Well, no, let me address that just first. That Sean Dione does the guy at Brown, I mean, he's a radiologist, does amazing work. And if I showed you how he actually does MRIs on babies, it'd blow your mind. I mean, it's incredibly sophisticated how they pull it. But he actually has done MRIs, and the MFGM can impact adults. In fact, there's, just like we see some of the data on vitamin D improving some of the stuff, and there's actually data on DHA improving dementia, attention deficit, and visual, macular degeneration. I didn't even talk about that. We see it in cardiology all the time. The cardiologists are very familiar with that anti-inflammatory effect of fish oil supplementation. But MFGM can actually improve some of the structural MRI of the myelinization, which is a whole new game changer, way beyond us. But I mean, it is very provocative to think about. I'm sorry, I didn't mean to interrupt you.
No, you're good. And obviously, I hate to say you trained a little before me, but not a whole lot. And so the one comment is, since Hugh Kraft said here, he will remember the name I'm throwing out, but in the era of Millie Stallman, who was our attending in the NICU down at Vanderbilt, we fed the baby. That was what we were asked. Are you feeding the baby? And now how you're feeding the baby is whole different. Despite the donor breast milk differences, it also explains why Vicki hands me a lot of bills on Monday morning to pay for donating breast milk, good or bad donating breast milk.
Yes.
It's interesting, we had a grand rounds, and I can't remember who it was, it's embarrassing. It was the person who talked about microbiome and touched on epigenetics and then the developmental impact. I don't know, most of it was over my head except the fact that the impact of what's in our guts in more ways than one. And of course, you're talking about what's going in there, but what's going in there also impacts down the line with the prebiotics.
I think that to me, and I think you guys know from what I send out, I try to be selective in what I send out, but this whole business of, if you sit here in 2023 and you just look at some of the incidence rates of autoimmunity, atopic manifestations, asthma, type 1 diabetes, Crohn's disease, obesity, you say, holy crap, there's a whole lot of things going wrong here. And we're starting to tie some of this nutrient effect to the microbiome effect, to the host response effect. And it's interrelated. We're starting to kind of unpeel the onion a little bit, but we're learning more and more. We've done GI, I remember doing fish oil enemas, when I was in training. There's other kinds of, we do a lot of stuff that we kind of try to, kind of influence that. But as we're starting to understand more about like this MFGM, vitamin D's role in terms of that, way beyond the calcium metabolism role that we've learned about in medical school forever. Now we're talking about, oh, okay, I can tell you that a pregnant woman who doesn't get adequate vitamin D, that her children have higher incidence of autoimmunity and atopic manifestations and asthma. So what was it? How's that happen? Because we recognize that some of these nutrients interface us structurally, functionally, but impact us in the autoimmune or in the inflammatory pathways as well. So I think that, and then we kind of get into this whole dysbiosis, hygiene hypothesis stuff. It's things haven't changed since COVID. When you think about that. Every 10 feet there's a hand sanitizer, that you're moving through the hospital, and we recognize that, the kids, we see some of this, we see kids who live in a rural environment and have pets, have fewer autoimmunity, asthma than kids who live in an urban environment. And I didn't show you some of the data, even maternal sun exposure, moms living in an urban environment, their kids have higher instances of autoimmunity and reactive airway disease and allergies. So we're starting to recognize there's environmental factors unquestionably, and the microbiome plays a huge role, but it's not the only role. Absolutely true. Great question. Other questions?
Yeah, so more of a comment. So with this, we know that, allowing moms to breastfeed is highly important, making sure we have the right composition. So we need to be not only advocates for the moms prenatally,
right,
give them access. We need to advocate for programs that get the nutrition to the families, the moms, the newborns, and the children. And so, and allowing breastfeeding moms to have time at their work to pump. So that's something that the industry has left behind, and even in our institution, it's a challenge.
You're so right. And we're the only country in the world that subsidizes breastfeeding mothers not to breastfeed because we have a WIC program. So that makes a social statement right there. There's no, and you're right about one thing. Both my daughters, I gave them the omega-3. I've got the most brilliant grandchildren on earth. But I had to laugh. My daughter Katie was a Spanish teacher in Omaha. Very progressive school. Very progressive school. She's breastfeeding. She was told you can't pump in the teacher's lounge. You got to go to the broom closet. I mean, how supportive is that? Don't let the broom hit you in your head while you're trying to. I think they let her turn the light on in the broom closet. I mean, I'm being facetious, but I'm being serious. We talk about being pro breastfeeding. Not so much, because we really subsidize women not to nurse. We are getting better though. We're getting in where it comes to the nursery. I think most of the neonatologists understand intuitively the importance of breastfeeding. If you can't achieve anywhere near 100% nutritional need, how important that early breastfeeding is, early exposure of colostrum, even if they've got a UVC or UIC. I mean, we worry about NEC because too much nutrients in the gut causes a splanchnic blood flow effect that basically can cause problems in and of itself. So, you activate delta receptors and you literally, that's why your mom told you don't go swimming after you eat lunch because you get cramps. Remember that? I don't know if the kids are even told that nowadays, but, and the reason for that is when you're activating skeletal muscles, you're driving blood flow to the skeletal muscles away from the gut. But the reason why we all get sleepy after we eat lunch is because the blood flow is going to the gut and away from the brain. But we recognize, so we don't, even in the sickest newborn, we recognize that early feeding is important for composition of the microbiome. Even if we can't achieve anywhere near full nutrition, you're so right, Joe, absolutely right. Other questions? I'm gonna give it to our hospital shortly. Thank you guys so much for inviting me.